The question was, we have all these options available. What role does a urologist play in making that treatment decision? The role of the urologist is to work with the patient, lay out what the options are, get the second, the third opinions in the various specialists, and then help the patient understand the good and bad, help the patient make the decision on what's best for him, as well as her, because prostate cancer does affect intimacy, it can affect erectile function, so it's also nice when a partner is available, a partner involved in that decision tree. But I think the urologist plays a critical role in letting the patient or giving the patient the appropriate information to help make an educated decision on what's best for him and his partner.
So we had a question come in that said, on September 29th, I'll begin chemo treatment with Taxotere. My urologist told me that studies show that the increase from 6 to 10 treatments is more beneficial, resulting in increased survival. There's also an article about this in the October issue of the Hot Sheet. Could you please comment?
So what I think our online patient is referring to is sometimes patients will present with prostate cancer. They'll walk in the door and the prostate cancer is already outside the prostate and spread to the bones. Okay, so it's metastatic prostate cancer. Fortunately, we only see this about 5 to 6% of the time, so it's not a very common thing. What the patient is referring to is there's new Charter data and Stampede data that will show if we give these very high-risk prostate cancer patients docetaxel, they will do better than just giving them hormones. So 2 years ago, those guys walked in the door, we just put them on hormones. Now there is data to support in metastatic, high volume, and even low volume prostate cancer to the bone. We will start with chemotherapy, typically six treatments, and in combination with hormone therapy. So I agree with that. That's kind of the new novel way to treat it. It's cutting edge data on how to treat metastatic prostate cancer at initiation. So that's great, and that's what we use when these patients walk in the door, is a combination of chemotherapy and hormone therapy will lead to better outcomes.